Carolina. And where I fit within the ESF and the ICS structure within our agency is I'm the communications branch manager. So what we're going to talk about tonight, for the most part, falls under my responsibility, both for the planning and then the when we activate for a disaster. It's my job to make sure that everyone can communicate and everyone is talking and everyone is making sure those lines of information sharing are open. Part of that responsibility is amateur radio, and I see some folks. I see a couple call signs and names. I see a React hat. So I think most of you guys, most everyone, I think at least has an idea of what amateur radio is. I am honored to be an amateur radio operator, W3FIE. And again, for you, yeah, KJ4ULR, got you. So don't let the W3 call fool you. I am not from the Pennsylvania area. That is actually my grandfather-in-law's call sign, Mr. Stone. So Mr. Stone was my grandfather-in-law. He passed away before I ever met him. But when I first met my wife, she said, "Gosh, you're a big radio geek. You would have loved my grandfather. He was a big amateur radio operator up in Philadelphia." And so lo and behold, I go and take my test, and I get my ticket. And that Christmas, my mother-in-law, his license was still active, and my mother-in-law gifted me a QSL card with W3FIE along with a vanity license, transferring it over to me. So James Stone, I am honored to broadcast in his honor every time I'm on the air, which isn't a lot, and I get bugged by Carl and the rest of the gang that I'm not on the air very much. But for those of you, I see a bunch of call signs going in the chat, and I appreciate it. And first off, from my perspective, for you guys, the CERT, I really, really appreciate what you guys do. We can't do this without you. Every piece of what we do within emergency management has value, and I just want to lead the way by saying thank you guys for taking time out of your evening to better prepare North Carolina for its worst day. So, all right. So now that is all out of the way. So we're here to talk about amateur radio and how it fits into the big picture of disasters and activations. So, let's see. I do hear somebody off mute. If you guys could just check it. Yeah, and good deal. Yeah, William, good luck. It's study that answer key, and then you normally will learn afterwards. So that's normally how that works. But again, if you guys just check your mic, I do see a few people that are unmuted. Cool. I think that helped it. All right. So amateur radio, right? It's really simply put, a special set of frequencies in the radio world, right? In the wizardry and geekery out there. Special set of radio frequencies that is used for amateur radio operators, licensed operators only. And that's kind of a world that the public safety community isn't necessarily, well, they cannot access those without a license. Where that comes into play during a disaster, I want to be able to communicate by any means necessary, and that includes amateur radio. It includes data over amateur radio frequencies. It includes shares, if some of you understand or have ever heard that term, right? So a few years ago, to kind of really codify this, the Department of Homeland Security got a group of really smart amateur radio operators together, national leaders, and they said, how do we integrate the amateur radio community into the ICS structure? So you guys are familiar with that, I'm sure. The incident command system, it's kind of like it's a hierarchy of like who's in charge, right? You guys, I'm sure, have taken ICS 100, 200, blah, 700, 800, all those fun things. This group got together at the national level, and they sat down and they said, how do we get amateur radio involved? How do we get them into the ICS structure? And how do we train them to be an effective piece of the overall incident management system, right? So, and I think the intent, at least when I provided my feedback for that, was I don't necessarily feel it necessary for the amateur radio community to just sit back and wait till everything falls down, right? I don't necessarily think that's a good use of amateur radio. I think amateur radio should be forward-facing, frontward-facing, and a primary means to communicate, which it is every day. You can probably turn on an amateur radio right now and find a net somewhere and check in and see how everybody's doing and talk about the weather, right? That's fine. That's good. So when the time came, I believe it was around 2011, the federal government, DHS, through CISA, it wasn't CISA then, but I can't remember what it was. They came to me and asked if we could host one of the pilot Auxcomm courses, right? So they came up with a class, they came up with a title, and then they said, well, we got to get out and train people. So we were honored to host one of the first classes here in North Carolina. So that's good. So how does amateur radio fit, right? So you have this thing that I just mentioned. It's called Auxcomm, right? So you have ARES, you have REVC, you have REACT, you have other various, and help me out, Carl, with the other kind of the other entities that are amateur radio operators. A lot of NGOs, church groups, faith-based organizations. They have teams and things like that, organizations that are together. Saturn, yep, cool. All of them play a really good role in the response or the recovery to a disaster. So CIS's approach was, why don't we just encompass all of those people under one entity, one box in the ICS world, and call it Auxcomm, right? So you have ARES, who is the Amateur Radio Emergency whatever that is, service. Many of you may be a part of ARES, right? Which is a great thing. So that is how we fit in. So whether it's special event planning, so it's the Albino Skunk Festival, whatever that is, right? So amateur radio, ARES, REVC. I think REACT, I'm not very familiar with REACT, but I know that is normally like a monitoring. So listening to the citizen band frequencies, listening to all these things, different frequencies, whether it's public safety, whether it's amateur, whether it's media stuff, just having a really good picture of what goes on out there. And if I'm wrong, please educate me. So with that said, that's kind of how in North Carolina we have a very, very active amateur radio community as far as the getting involved, and how you guys can get involved from the amateur radio side is if you are so inclined and want to push ahead forward on training and experience and getting out there and doing it, there's options for that. So real quick, I do want to give it over to Carl Bowman, who's an instructor and a former, I believe you were the state ARRL. You held a you definitely held. I forget what it was, but please correct me. Carl, are you on, sir?
Very comp check. Perfect.
Good to go.
Thank you very much. First of all, greetings, everyone. I've met some of you in other activities. I was from 2014 to 2020. I was the section manager, ARRL section manager for the state of North Carolina. And that introduced me to a lot of very interesting situations and activities and interests and capabilities within the state of North Carolina. My journey getting involved with the Auxcomm, or the auxiliary communicators, that's the Auxcomm's the nickname, began in 2014 as I encountered key people and received encouragement and mentorship. Greg was an important individual in this group. I grew, and that started with taking ICS courses so that I understood emergency operations plans for the state of North Carolina, and then also how I might possibly begin. And then I took the Auxcomm course, which is a 3-day course occurring primarily on the weekends. That gave me another set of skills. I got involved. Now, I've gone farther than that and needed to go farther than that. One, for my interests, which were personal, but the other thing is to become an instructor, I have to have more experience and credentials than just taking a few courses. But I guess the most important thing I want to say is the journey was worthwhile. It was not easy, but nothing that's worthwhile is easy to accomplish. I feel like I'm giving back to my community, and I encourage you to take a look at it as well. I've had the CERT basic course. I understand what your basic training is, and the focus, in the first 2 or 3 hours of an emergency, and the way in which you fit into your local community, or actually your local neighborhood, and then eventually to your community. But if you're interested in going further, I'd like for you to consider looking into what a affiliation with Auxcomm could be, and ways in which you can train. And I think at the conclusion of this, Greg and I'll put together some sort of an email that we'll give to Samantha, and then and detailing some of this information for you. Anyway, thank you very much, Greg. I appreciate the time, and I hope I didn't make too many mistakes. Over.
Apologies, dispatcher error there. Yes, no, thank you, Carl. Yeah, so exactly. So how does to elaborate a little bit into kind of where we're going here. And Samantha, how much time do we have before I start sharing things?
You can have about another 8 minutes or 10.
Okay, perfect. Okay, perfect. So I'm going to show you guys this just to, and I encourage you, as Carl said, I encourage you guys to stay involved, whatever that looks like, whatever amateur radio like group you want to be a part of. Please stay involved. It is all beneficial, right? So sometimes in the disaster world, specifically the communications world, pride and egos sometimes get in the way of helping out who we need to help out. Please don't fall into that trap. Specifically, and even in the amateur radio community, there tends to be some a little bit of push and pull there. So, but I encourage you, go after, be good at what you're doing, right? Be really good at it, whatever that is, whether it's Aries, whether it's React, whether it's Saturn, any of that. Be good at it, because we're going to need you. We're going to need all of you, when North Carolina's worst day comes, which we all know it is. It's just a matter of time. We don't want it to happen, but it's our job. You are on this call right now to plan for that specific action, right? So that's why we're here. So I encourage you to go after that. So I'm going to show you.
I love that advice, Greg. That's awesome. Just be good at what you do. And like when I'm teaching a CERT basic training class, I'm like, y'all can just check your egos at the door, because we are all working on the same team for the same mission, right? One team, one mission.
Yes,
so I love that.
Yeah, and a lot of our, especially volunteers, you guys, most of you are volunteers, and volunteers are gold we cannot do what we do without volunteers. You guys live here. This is your home. And you have the ability to make a difference. That's worth a lot to me, even me. So when we need all hands, we're going to need all hands, and I appreciate it. So real fast, I'm going to share a couple of slides, right? There's a couple things that we teach, or Carl teaches in the auxiliary communications course, which involves all areas, all of this, right? So this is how we operate in the communications branch, right? So we're founded on 5 principles, and they're here. So our I guess my advice to you, specifically with going into something that sounds bad, looks bad, if you can focus on these 5 things, this is going to be, you got to be honest. When it's bad, you got to know it's on. When it's really bad, you got to be honest that it is bad, because when it's really bad, we want to make it really better. So we have to work together as a team. And how do you make a team? You form a relationship, and you guys are doing that right now. All right. So kudos to the Auxcomm program and the amateur radio community. They're founded on these tenets, right? And I want to show you this group. Can you guys pick out the amateur radios in this group, or amateur radio operators? Right? You can't. So that's how we also roll. Volunteers paid, patch, triangle, circle, square, doesn't matter. that's also, it has to be nameless. Everyone is in it for the same reason. And then I also want to go down to my amateur radio operators and show you that, if you get dizzy, I'm sorry. Let's see. So this is a common misnomer for in the public safety world. Our amateur radio operators get a bad rap, right? Because they wear hats that have letters and numbers on them, right? So Brent, I don't even know who Brent is. I scraped that off the internet, but there is no difference between what you're seeing on the screen. You know, I was a member of the Beckett Fire Department in Massachusetts, and I was a member of Engine Company 2. So Engine 2 and KBO, ZCO or 0, KB0 ZCO, those are the same, right? That's pride and ownership. So please, those, you know, being an amateur radio operator is normally a stereotype of people in the basement tinkering with toys and making everybody's TV scramble in the neighborhood, right? So, and I know you guys all know that or have heard that. So again, and so this is the intent of what I'm showing you right now is for other states trying to build this program. But a lot, you know, a lot of that is pretty critical to us here in North Carolina. So, yeah, I mean, that's pretty much it. I'll give you guys a couple minutes for questions, and you have Carl on the line, which is a great resource. And then, and that, I mean, you guys live this. Don't believe that one technology fixes everything. I mean, you guys get that.
Yeah.
So
I have a couple of questions.
Absolutely.
I want other people to ask questions too, but my first question to you would be, if someone who's now involved with CERT and they're looking at learning more about radio communications and they want to get their ham radio license, how do you find a class near you so that you can learn what you need to do to get your general or your technician license?
Love it. Yeah, great. So ARRL, I believe on their website gives, Carl, go ahead. I'm not even going to try. Go ahead, sir. You're the man.
There's 3 levels of licenses in the amateur radio world. There's the technician, the general, and the advanced. The technician, which is the entry-level license, that could be done by self-study or through classes. In amateur radio clubs in the local area frequently will give classes, and there are other resources. You can find them on the ARRL website. The exams, common question, and the exams are administered by local hams that are deputized, so to speak, as volunteer examiners. And a lot of this activity revolves around clubs. So my first recommendation for North Carolina residents is to go on Google and search for amateur radio in your county. It might be an adjacent county, and frequently a club will pop up. Go to their website and follow probably one of the most important pieces of information that Greg has given you, and that is establish a relationship. And once you establish a relationship and have shown the interest, they'll respond in kind, and you're on your way. Over.
Well
Thank
said.
you, Carl. Appreciate that. I put the website in the chat there too for ARRL. So if people want to go and check that out, they have tons of resources there, including places where it'll help you study for your exam. You can find resources off of their website. I actually have 2 more questions. I'm sorry. So a lot of us use different types of radios for inter-team communication, and are we within our bounds doing that? Where's the cutoff as far as the kind of radio that I would have to have a ham license versus if we're just, in a small area using kind of 2-way radios?
Really good question. And darn, my handheld is way over by the front door, but so it's kind of tricky, right?
Got some radio.
So it's tricky. The radio, looking at a radio or a phone doesn't necessarily dictate what it does. So they all look the same, right? It's like Kleenex and facial tissues. I think if you understand the frequencies that you are going to talk on, and when I say that, it's not necessarily, hey, go to channel 1 and start talking, right? another part of my job, there you go. Okay. So another part of my position is to make sure we're coordinating frequencies and authorized to be talking on frequencies. So in order to talk on amateur radio frequencies, you have to have a license, right? So unless it's a time of disaster, and you make sure that is coordinated and all on above board. And during that technician, when you're studying for your technician's license, you'll learn what those frequencies are, right?
Great.
There's 70 centimeter, there's 2 meter, those things. Now, you can use those for inter-team communications as much as you want, so long as both people holding the radios and transmitting on them are amateur radio licensed. Great use of that resource. You can peel the onion back and talk about repeater versus simplex and all those other things that are more advanced concepts. But the one thing that I do love to tell amateur radio operators that to broadcast on a public safety radio, all you have to do is have authorization from someone in that organization, right? So from my perspective, if I hand Carl a Viper radio or a radio that's capable of talking on Viper, he's good to go with it. If I hand him a radio and say, you're going to be listening to State Event Talker Delta 1, please go with that and answer them and get them what they need. That's perfectly acceptable. Perfectly acceptable.
That's great.
So good question.
And the last thing I wanted to say before I let other people jump in here, because I know I'm totally monopolizing this, and Ken Stark, I'm going to put you on the spot. I see him waving his hand. Carrie CERT does host a net on the third Thursday of every month, and I do have the information on the NC CERT Facebook page, and I'm happy to share that, or you can go to the NC CERT Facebook page, and that info should be on there on the events. But Ken, would you like to say anything about your monthly net? I think you're muted. Oh, can't hear you. I will send that information out again, but it is on the Facebook page. So do check that out. You've had folks from all over North Carolina, literally Murphy to Manio, who have joined on that net, and they usually give you some CERT related tasks. Like this month, we're going to talk about triage or something, and give you something CERT related to talk about on the radio. And if you don't have your ham license, you can listen. And there are even ways, if you don't have a radio, you can listen through your computer, and all that information is also on the CERT Facebook page, so you can take part in that. Now, I'm going to shut up for a while and see if anybody else has any questions about radios. There are some good comments in the chat too about GMRS licenses. And then I see some folks have put other websites in there for Orange County and Durham. So if any of you are in those counties and looking for a radio club, I'm going to check out those websites. Anybody else have questions?
I appreciate that.
Yeah.
I appreciate that comment about GMRS licenses and things like that. That's a really good use of that. Something to consider. Also,
For
there
our
was
inter-team communications, or
FRS or GMRS, those things. I mean,
yeah.
It's kind of a free for all, but getting the GMRS, or going after your own licenses is perfectly acceptable, and I can help you. Samantha, if you guys choose to do that as a group, a state group, we can go after some
great
public safety band licenses, so you guys can carry whatever. That's up to you guys.
Okay, we'll talk more about that.
Roger that.
Great. If no one else has a question, I really want to thank Greg and Carl for being on with us tonight. And just one more time, I'm going to be quiet to see if anyone else wants to jump in with a question.
Samantha.
Yes.
This is Mitch. I'm the one that has president up there. That's for,
yeah. Hi, Mitch.
That's for the Amateur Radio Club. I'm presently president of, and I couldn't change the name on it. I'm in Caldwell County.
Great.
So could you just talk about how you can, some examples of how you can take the test if it's not in your local area? Like if you're up in, like, for example, I'm just giving this as an example, Avery County, which is
way out there.
Way up there.
Yeah.
Can you give us some examples? I personally took it. My general test online last year during COVID, and I was in Caldwell County, but I actually took the test in California.
Oh, wow. Carl, can you speak to that? How you might take the exam if there's not one near you?
Prior to COVID, exams were administered, and frequently there's a lot of exam activity at the major gatherings that hams are likely to go to. They're referred to as ham fests or amateur radio conventions. So people might save up for their exam, priority for that kind of a period. When COVID came on board, there was a lot of interest in remote teaching. I'm not a VE, and I'm not, well, I am a VE, but I'm not involved. I haven't been involved for probably 8 or 10 years. But there was a lot of interest in remote training, and they are doing it. Again, whether that's being done and how it's being done is probably going to be related to the particular group you're interacting with and whether they have that authorization. So I would refer you back to the local website in the communities around you and the clubs that are there and for further information. Over.
Awesome. Thank you, Carl. Appreciate you fielding that question. So there are options wherever you are in any county in North Carolina. We can find a way to hook you up so that you can get your exam done. That's the long and the short of it, right? Great. I see someone put some Chatham County information in there as well. So again, thank you to Greg and Carl and our other Auxcomm friends for being on tonight. I really appreciate it. And Greg, would you mind just throwing your email in the chat there? And if anybody has further questions, they might be able to reach out to you. Putting you on the spot again.
Will code. No, you're not putting me on the spot. Absolutely. Stand by. It'll be in there in 1 second.
Awesome. So any other general radio questions? Greg's your guy. As he said, he's the SWIC or the statewide, whatever that stands for.
I don't either.
So
I don't
he's
know
the
what that
radio
stands for.
guy. So make sure if you have questions, there's his email in the chat. So thanks again, you guys. Really appreciate y'all being here. You're welcome to hang out for any more of this meeting. Or I know if you're busy, we're going to move on to another topic. But thank y'all so much for your time. And Carl, it's awfully good to see you. Take care. All right.
Thanks, everybody. Thanks for what you do. We appreciate you.
Thank you so much, Greg. Next on my list, I have Mr. Nicholas Thorpe. Are you there, Nicholas?
I'm here.
Hey, I see you're in as Nicholas Capital. There you are.
Yeah.
How are you? So I see it says MRC after your name. So what can you tell us about what you do and how CERT volunteers could get involved with that?
Yeah. Sorry, I got a lot going on in the house tonight, so you might hear any number of things going on behind me. So thanks for letting me be on tonight. I'm very thrilled and excited to always talk with our CERT partners across the state and in our region. My name is Nicholas Thorpe. I'm the emergency planning exercise specialist with the Capital with the CAPRAC Healthcare Preparedness Coalition, and I'm the Capital Medical Reserve Corps coordinator. As everyone should know, and I'll just lay the groundwork now, the Medical Reserve Corps was birthed out of the Citizen Corps program in 2001 following the terrorist attacks on 9/11. And since then, they've taken us out of Homeland Security and stuck us in the Department of Health and Human Services under the Assistant Secretary for Preparedness and Response. So whereas CERT, you guys primarily focus on all hazards and first responder augmentation, supplementation, and community-based responding and preparedness, the Medical Reserve Corps, we focus on the public health and medical aspects of disaster response and volunteerism. In the state of North Carolina, we have I'm trying to figure out how to approach this from. So North Carolina, or North Carolina Office of Emergency Medical Services has a contract with level 1, level 2 trauma centers throughout the state to be responsible for healthcare preparedness in specific regions associated with the different hospitals. So the CAPRAC Healthcare Preparedness Coalition is a 5-county region that includes Franklin, Harnett, Johnston, Lee, and Wake counties. And each each of the different hospitals, level 1, level 2 trauma centers, they each have various sizes of regions that they're responsible for. So ERAC, or Eastern Healthcare Preparedness Coalition, out of Vidant Hospital in Greenville, has the largest region, but has one of the lowest populations. Us in the CAPRAC, we have the smallest region, but we have the second most populated region in the state. So the regions all vary between urban and rural. And each of these coalitions maintain volunteer programs such as the State Medical Assistance Team, or we call them SMATs. These are very similar to the disaster medical assistance teams you see or hear about from the federal level, that are Type 1 teams. So they're the most robust teams out there that deploy across the country to help out during public health emergencies. Hold on. Okay, get one. I have a kid stealing a donut right now. So when we look at how you can get involved in, and what we've been trying to do in the CAPRAC region with our Medical Reserve Corps is to partner with our CERT volunteers, because what we have discovered through Hurricane Matthew and Florence, and even through the pandemic, and just over time, is that, and what we see in the hospitals is that for every medical profession or specialist in a hospital or in a disaster hospital setting or first aid station setting, there's 1 or 2 or 3 non-medical people that have to be there to support them logistically. And so our Medical Reserve Corps target audience is non-medical volunteers, and we are there to support logistically our team, our health infrastructure in our region. And then locally in isolated events, doing that basic first aid and basic life support care. And how does CERT roll into this, and how do we partner with our CERT partners? We recognize the expertise in that our CERT partners in their own personal, their own investment into personal preparedness, but also through the national CERT curriculum and everything that entails. I started my career off as a CERT volunteer, so I'm very familiar with the program. Not to mention the amateur radio capabilities that we just heard about. And so our goal here in the CAPRAC is to partner with our various CERT partners to bring them in to help bolster our capabilities, whether it be in communications, whether it be in logistics, situational awareness, common operating picture, and I mean, just about anything out there that would go towards helping bolster the public health infrastructure. And one of the things I would love to impart to our CERT partners and our CERT coordinators specifically is we're always looking for that opportunity to cross-train and collaborate on either specific missions, either whether it be a nuclear exercise or in supporting various vaccination clinics. I know we tried and we're working with Terri's CERT specifically to try and bolster our numbers of getting people out to support various vaccination clinics. We reached out to CERT just recently to help bolster our numbers in support of the balloon festival that's coming to Franklin County this weekend. And it's proving that there is that opportunities there, and I think those opportunities exist across the state. Each CERT each Medical Reserve Corps program or SMAT program amongst the different coalitions are going to act and feel a little different. And so if you're looking to get involved with these programs, your first best bet is to become a volunteer yourself, and then you can make that decision on who you want to deploy with at any given mission. As a CERT team looking to partner with another team, you really are going to have to work to make yourself known and develop a partnership. So it's not always going to be what can they do for you, it's what can you do for them, and then proving that capability. A lot of our Healthcare Preparedness Coalition partners are very skeptical about outside groups coming in, and it's very similar at the hospital level. So you're going to have to put on your marketing hat, if you will, and your friendly faces, and really strive to try and meet them where they're at, and be consistent, and follow through on what you say you can do, and that's going to build trust within the healthcare coalition. Give me a second, okay? Each of the programs look a little differently. Here in the CAPRAC, we separated our MRC groups from our SMAT groups. I do a 3-hour orientation to get you on board. A lot of our other partners, they want you to go through the state standardized state medical assistance team initial training, and that's in flux right now. They're trying to update that and standardize that across the state. And those are 2 initial ways you as an individual can get plugged into the coalition, so you can start receiving those terms notifications about special events or public health emergencies that we're supporting or that's being supported across the state. Samantha, I'm rambling. I feel like I'm rambling. Am I hitting
No,
the
you're
talking
great.
points?
I had just put in the chat regarding what you just said, that it's just the same thing Greg was saying in his presentation about building relationships. You know, that then that's so important with the MRCs or the SMATs too, is, you know, don't expect you're just going to walk in and be able to help, but let them know what your team is capable of and what you can do for them. And I think you'll find that it can be a rewarding relationship for both sides. So it can be a win for the CERT volunteers, and it can be a win for the MRCs or the SMATs who need some more help. I guess my question, Nicholas, would be if somebody, because not everyone on this WebEx is in like the CAPRAC area. You mentioned it's Harnett, Wake, Lee, Johnston, you're in those areas, right?
Right.
So if somebody's somewhere else in the state, how can they find where their local MRC or SMAT might be?
Yeah, it's a great question. So one of the ways is to search for the North Carolina Healthcare Preparedness Program, or HPP, under North Carolina Office of Emergency Medical Services, or OEMS. And that's going to bring up a map of all the coalition sites. And so I can name them off. So you got Vidant out of Greenville, Southeast Regional Medical Center in Wilmington. They always change the name, but the big hospital in Charlotte.
Is it in Metrolina?
Yeah, it used to be Metrolina.
Yep.
Yeah, it's the Metro.
Yep.
It's the Metrolina Healthcare Preparedness.
Okay.
Coalition.
I don't know if you can see it. You looks like you might be on your phone, but
Yeah.
I'm sharing a screen now. So
Yeah,
yep,
that's
and I put the address in the chat. So y'all find your county where you live, and you can see. And each one of these is a link. So if you're in this area, just click on that, and it'll take you right. Oh, that says coming soon, but bad example. Anyway, you can see where the different regions are, and that the entire state is covered. So wherever you are, there's a group that you could link up with. And I can speak from experience for local certs for Apex, Cary, Morrisville, Lee County. A lot of these groups have partnered with Nicholas and his guys for doing vaccine clinics and the balloon festival and first night in downtown Raleigh, not this past year, but in years past for New Year's Eve. And there's lots and lots of opportunities. So, and they don't always need medically credentialed people, because I'm not an EMT, but I'm able to still help out. Now, of course, I'm not giving vaccinations or anything, but there are other jobs. So you might be helping out with traffic or data entry, and all of those jobs are just as important as the people putting needles in arms, because all of the pieces have to come together. And, you know, as CERT volunteers, we're really good at paperwork, and we do have training in traffic management too. So don't think that just because you're not an EMT or a paramedic or a nurse that you cannot help, because there still are jobs for you.
I really do appreciate the CERT program. Somewhat because you all don't have as heavy-handed of a medical footprint. You know, you guys teach basic first aid concepts, and you teach triage. And what we see is medical individuals have a tough time doing triage because they want to treat every individual.
That's true.
And me coming through the CERT program and everything, and I know CERT can triage the heck out of people. And you guys are really good at situational awareness. So I love partnering my medical staff with CERT partners, because I know they're looking, their heads on a swivel, not only trying to find unsafe things, but, you know, making sure they're not finding themselves in an unsafe situation, and they're looking out for their partner. So
absolutely,
you guys bring a lot to the table for us at the medical side.
Thanks for that, Nicholas. Appreciate it. do you all have questions for Nicholas about, now he's specifically with CAPRAC, but he can also answer general questions if you're in a different part of the state, like what opportunities could be available for your CERT program wherever you are. You have questions for Nicholas? All right.
Hi, I have a quick question.
Yeah, great.
Sorry, I just am moving to Carteret County next month.
Great.
And I've been with the CERT program in Iredell County, but I'm a registered nurse. So I would love
Super.
to actually be able to kind of like, what, is there a person that I could try to email specifically for this part of the state? Nicholas, do you know?
So Carteret County,
Eastern, Biden.
The Eastern and Biden. I just didn't know if it's like
Yeah.
maybe there's a name that of someone
gonna
that could
be-
be thrown
I would
up.
start with Chris Starbuck. Sort of spelled like the coffee, I think. But he's the Healthcare Preparedness Coalition manager with the Eastern Healthcare Preparedness Coalition. They have a really good team out there. They're really active. They do a couple marathons every year, and then they're the lead
Not signing up for a
coalition
marathon.
the air show every year out there.
Not to, you don't have to run in it.
I'm just kidding. I'm just kidding.
That's awesome. So yeah, I'm looking on the EHPC website and I'm not seeing an email, but I'm sure that we could find one. There's a phone number at least you could get. Here's the website for the Eastern Healthcare Preparedness Coalition in the chat right now. So check that out. And they do have the phone number there for the SMAT. So
Feel
that
free
would
to,
be a good place to start.
Matthew, you're more than welcome to put my email address in there,
Okay.
and I can respond with specific contact information to anyone across the state.
All right. I just did that off the top of my head. Is it right? nithorpe@wakemed.com.
Yes.
Yes, I know it by heart. That's awesome. All right, so that's Nicholas Thorpe, nithorpe@wakemed.com. If you think of other questions,
.org.
oh, I'm sorry, wakemed.org. Let me retype it. Shoot, sorry. All right, nithorpe@wakemed.org. There. So ignore the first entry. It's .org, not .com. My mistake. But Nicholas is a great resource and very knowledgeable about anything SMAT or MRC. And by the way, it's SMAT and not SMAT.
Right.
Don't say SMAT. They don't like
say
that.
SMAT.
It's SMAT. Yes, that's an important. You know how we love our acronyms, right? In emergency management, so you have to know how to say them. Nicholas, anything else you want to share with the guys? And do you have enough help for the balloon festival this weekend?
So I could use some more I could use a few more for Friday from 11 to 6 p.m.
Right.
And it's in Lewisburg.
Yep, up in Franklin County.
In Franklin County at
Yep.
the First Fruits Farm.
How's the rest of the weekend looking? Are you covered?
Saturday's pretty good. I could probably
Okay.
use a few more volunteers, either starting at 11 o'clock in the morning on Sunday or starting at 4 o'clock in the afternoon on Sunday.
And if people come out to the balloon festival, what would they be doing to help
So
you?
you'll be partnered with hopefully another medical volunteer, and potentially not, but your job would be to essentially to rove around the footprint of the venue in an ATV, most likely, and help with what we call non-patients. So these are people who are asking for Band-Aids or simple over-the-counter requests, maybe for Tylenol or Benadryl. And beyond that, you're out there also trying to identify any kind of potential unsafe situations or unsafe activity that might be occurring. And you would
sounds
report.
like right up the alley of a CERT volunteer.
Right.
Mm-hmm.
And I think we have a few CERT volunteers have volunteered
Yep.
already. They're on our roster, and I think they're coming out.
Yeah, I know of a few. That's great. Yeah. And I'm guessing they'd get to use radios, which ties us back to our first speaker, right?
Yeah, so we'll be on 800 megahertz on a Viper radio.
Great.
And they could be.
See how I tied that all together?
Or
it was really slick. So yeah, great. Well, anybody else have questions for Nicholas? We good? All right. Well, Nicholas, thank you so much for joining us this evening. I know you're so busy, and I really, really appreciate you taking the time out to spend a few minutes with the CERT gang.
always my pleasure, and I'm certain till I die. So
Yes, you bleed green, right?
that's right. As long as
Excellent.
it's neon.
Somebody wants to know, for the balloon personnel, do you need medical personnel and or non-medical, or specifically, are you looking for medical personnel?
At this point, I need bodies. I'd rather have individuals who are certified in CPR, first aid, AED. But I'll take someone who's willing to come out in 95-degree weather and dodge lightning.
Hey,
bolts.
Sunday should be gorgeous though, so
Right.
hopefully it'll
Sunday's
cool
gonna
off
be
for
awesome.
you. Great. All right, did that answer your question, Julie? You good?
Yeah.
All right. Fantastic. Well, thanks again, Nicholas, and I'm sure I'll be seeing you soon. Thanks
Sounds
for
good.
everything.
Yep. Bye.
Have a good night. All right. So we've heard about 2 different ways that you can branch out besides just your regular CERT training. We've already talked about radios and getting your ham radio license and how important communications are. And oh, Fred's asking, I'm sorry, Fred, didn't mean to put you on the spot. Nicholas, if you're still here, does MRC only use Viper? I think you did mention 800 as well, didn't you?
Yeah.
You
So,
may-
well,
yeah.
I mean, so we're all on the Viper network. So we all use the 800 megahertz radio that are tied in with the state Viper system. Some teams use UHF locally. Like tomorrow, we'll be handing out UHF radios for team radio capabilities, and we partner with CERT to help with our help with communications on the amateur side. Should a hospital or a healthcare facility, or we have a catastrophic event in the triangle, we'll
That's
be reaching out to our CERT amateur radio partners for interoperability at that point.
Awesome. Cool beans. Well, thank you again, and we really appreciate it. And remember, guys, his email is in there, and it's the .org email. If you have any availability this weekend to go up to the Balloon Festival, shoot Nicholas an email. I'm sure he would appreciate it. And if you have any other general questions about MRC or SMAT, you're welcome to ask him those as well. So I want to thank you again, Nicholas. Glad to have you here. And I'm going to move on to our next speaker. Terri Richards, are you here, Terri? I think I saw her name on there before.
I am here.
She's here. Great. So I have this acronym next to your name and it says REVC. What the heck is that anyway?
So good question. So the REVC is the Radiological Emergency Volunteer Corps. It is, I have to thank Nicholas because he explained what a Medical Reserve Corps unit is. And the REVC is another MRC in the state, but we don't fall into groups, into different medical coalitions. We are one gigantic happy family across all 100 counties of North Carolina. There are not a whole lot of us. We recently transitioned from OEMS to North Carolina Emergency Management. I am the coordinator now. And we are in the process of updating all of our documentation. But what we do is we support reception centers during a radiological emergency, or since we thankfully have not ever had a radiological emergency that required a reception center, we help our plants in the state to practice and train and operate their reception centers when they are conducting graded exercises for the MRC or for FEMA. And then we help them by training and setting up decontamination stations, by running, helping public health run and set up registration centers for population monitoring, and running radiation portals. And Sam, is it okay if I share?
Please, yeah.
Okay. Let me see if this will do. All right, can you see this, Sam?
Yes.
All right, so this is our crazy group. I'm going to flip down slides here.
There's Nicholas. That's our last
yes,
speaker right there.
So our last,
in the front.
Yep, Nicholas there in the front. Yeah, he is actually on our leadership team. So he's been part of it. And there in the corner is Pete Bowler.
Yep.
He belongs
Civil Air
everywhere.
Patrol. Yep.
Civil Air Patrol, yes. He is also a FEMA DMORT leader. And if you don't know what DMORT is, that's a disaster mortuary team. So
And I'm pretty sure he has his ham radio license too.
I don't know if he's
I wouldn't be
kept that
surprised.
up,
Okay.
but he does do a lot of search and rescue, and he does
Yep.
he plays with the big boys. So we have those guys, and when I talk about helping to operate portals at reception centers, this is what I'm talking about. This particular exercise looks like it was conducted at Southeast Raleigh High School, or at East Wake Middle School, one of those two hallways. The picture's kind of ambiguous, but you can see the everyone's wearing PPE, and the monitors themselves are wrapped in plastic, and that's to keep the monitors from getting contaminated. And it's really fun to do this. We have time limits that we have to keep up with. We have to monitor how many people are going through. But here's another group of our happy people playing. What you may not have known is that we have 4 nuclear power plants that have a 10-mile emergency planning zone inside the state, or for the state of North Carolina. 3 of them are inside North Carolina, and 1 is in South Carolina. There are an additional 6 facilities in South Carolina, Tennessee, and Virginia that impact a 50-mile emergency planning zone, which starts to get into your food supply chain and such. So of all 100 counties, there are 66 that could be impacted by an accident in a nuclear facility. I have this slide, which is really busy. It's supposed to show you where you would work, but all the orange dots that are on this very messy image that was taken from one of the books that Duke Energy puts out, those are all reception centers. And in some areas, this one is for the McGuire plant near the Charlotte in Mecklenburg County, near Charlotte. There's a lot of people to move, and we don't expect all of them to go through. We actually only expect about 20% of the people to arrive at a reception center, very much like a hurricane evacuation or something like that. We operate through North Carolina Emergency Management, so our county emergency managers would put in a request to the state through emergency services, and then they would send a notification, and we would push out that request for volunteers. Sam and I I work across the hall from her husband because he's my coworker in the REP program. And then, so for those of you that know Jay, but Sam works up the hill when she's in the office. We get to get our
year sometime. Yeah.
Yeah, we get to get our steps in when we go see Sam.
That's right.
But we would like to do exactly what Nicholas has been doing with the Capital MRC and cross-train CERT members to get a little bit more knowledge and training on the radiological response side. I mean, I'm actually a CERT train the trainer. One of these days, Sam will actually. Well, no, I helped Sam with a class when her power went out, and I just took over and started teaching.
Works.
But one of these days, she'll get me in the program manager's course. But we've been through that training where you're going through your CERT basic training, or you're teaching the CERT basic training, and you have that little bit of radiological training and the immediate response. Well, this isn't quite the immediate response, and for a nuclear power plant emergency. They typically go a little slower, so we might get the notification, but it could be 2 or 3 days before we actually needed to set up a reception center. Or we could have what they call a fast breaking incident, which means something really bad happened very quickly and we all have to hit the ground running. Either way, it's really beneficial for us to have a lot more volunteers, and hopefully the additional training that you guys can get through volunteering with REVC will expand your capabilities as well, especially since you get to do cool things like counterterrorism operations support unit training. We don't have to. We don't get to do the super cool stuff. So you're not gonna put on a backpack and a Class A PPE and
No.
take off down the road. But
Pappers and cappers.
yeah.
Thank you. Terri,
Um,
how often do you have training? Like, do you all meet? Like, a lot of our CERT groups have monthly meetings where they get together. Do you guys do that, or what? How do you get trained in REVC?
So previously, we had one annual meeting, and everybody spent the day up at the State Emergency Operations Center going through the training. We are in the process of establishing quarterly meetings, and then every year we have 2 plants that participate in graded exercises, and almost always there's at least one reception center that has to be graded and that they want to stand up and practice. This year in July, we have 4 new reception centers that we have to train and staff people at for a graded FEMA exercise for the McGuire plant near Charlotte. They have just transitioned from their previous facilities into these 4 schools. So between those graded exercises with the counties for the surrounding the nuclear power plant, a quarterly meeting, and then online training resources that we are opening up to volunteers, you could train to your heart's content and probably not run out of anything to learn.
Awesome. So Rusty has just put in the chat that he wants in on this, and he says he's a hazmat level 1 with OSFM. So if people want to learn more, is it okay if I put your email in the chat so they can get in touch with you?
You not my email.
Okay.
I have I'm going to pop up the bottom slide here.
There we go.
So the cool thing is that the REVC has its own email with the state. So Sam can poke IT and maybe get a CERT email for you.
I have one. I have CERT at NCDPS. Yep, absolutely.
Okay. So we have the REVC, and that's the one that I would like to get all of the
perfect
REVC communications through.
Great. So Rusty and others, if you guys want to get involved, I put that email in the chat. And there's very long, because that's where that's what we do, is have very long URLs. But I'm trying to type it real quick so I can put it in the chat, so you can just click on it.
Would you like me to just copy and paste it?
Yeah, copy and paste that in the chat. That'd be great. And then they'll just be able to click on it right from the chat, and it'll be easier. So
yes.
Yeah.
All right.
Yeah.
So
good. Earl's also interested. And so Earl is in Cabarrus County. Earl and I am so happy to see you here. Side note, I'll talk to you later. And Rusty is in Rowan County. So they're both pretty close to the McGuire area.
Oh, that's absolutely wonderful.
Good.
There's a great need for people to man reception centers and help us and learn that process. We used to be very focused. The group used to be very focused on health physicists and people with very technical skills, and we are working to expand out and have medical volunteers, meaning doctors, nurses, mental health specialists,
Great.
anybody, who can do administrative work, people to do, to help out with gross decontamination of the.
So what's the danger too? Like if I wanted to volunteer with REVC, am I going to be irradiated? How dangerous is it to get involved in that?
So you are most likely going to be exposed to less radiation than you would get receiving a chest X-ray.
Great. That's good to know.
The majority of people that would arrive at a reception center with some sort of exposure are going to come in having been exposed to what's called radioiodine because they were inside the plume cloud. It doesn't get on you, it gets in you. And once if it's not, you can be contaminated, which is a surface contamination, is what we try to wash off when we decontaminate people. But it's not going to look like your video games like Fallout or Stalker or anything like that. You're not going to be walking through a nuclear wasteland or anything.
Glowing in the dark or anything like that.
Yeah, no.
Okay,
although radiologic, uranium does glow a very beautiful, like Caribbean ocean blue.
Oh, pretty.
When it's
nice.
in water.
It could make a nice necklace or earrings or something.
It'd make really cool. You probably don't want the level of radiation that close to you for jewelry.
Probably not.
But
so
yeah,
again, guys, if you're interested, Terry's put the website in the chat, and we also put the email address for REVC at ncdps.gov in the chat there. So if you would like to get more involved, please do check it out. And it's great. It's just like with the Medical Reserve Corps, where there are so many overlapping skills where I think you could have well-trained CERT volunteers who could be a real benefit to your program. And I'd love to see more cross-training there. So that'd be great. Y'all have questions for Terri? I'm sorry, Terri, I didn't mean to cut you off.
Oh, no, I absolutely agree. Getting all of our groups cross-trained and whatnot is going to be beneficial in more ways than we can probably count right now.
Great. How about any questions for Terri?
I have a question. This is Urmila.
Okay, go ahead.
Terri, I went to that training. I think that was the first one at the school that you guys had. Do you have plans on when you are going to have the next training?
So the next we're still waiting for our final go ahead to open the doors again. To try and have the
post-pandemic,
post-pandemic in-person training. We kind of like to get everybody together again, and then we'll have virtually based opportunities throughout the rest of the year to do those things, along with in-person for the exercises. So I'm hoping that in August we'll be able to do our annual meeting and training again.
Okay, thank you.
Thanks for that. Any other questions for Terri? All right, well, you know how to get in touch with her. You've got the website and an email address in the chat, so be sure you hang on to those. And Terri, I want to thank you so much for joining us tonight and letting us know what you're up to. I think it's a great program.
Thank you, Sam. I really appreciate the opportunity to come and speak to everybody.
Awesome.
I love working with CERT. I've done it for a number of years. Yeah, I know Sam has been in CERT since forever, I think.
It's been a while. It's been a minute, as they say. It's been a minute. Yeah. So thank you again so much. And y'all reach out to Terri if you'd like to learn more about that. And I'm going to turn to our last speaker, who's showing up right in the middle of my screen there, Mr. James Wong. And James, if you could introduce yourself, and we've got a couple different acronyms.
Did you just cut out, Samantha? Or is that just me? Can you hear me?
We can hear you, James. I lost Samantha too.
Yes, we can't hear you, Samantha. It was definitely Jay. Jay was
There
back
we
there
go.
playing with the cables.
I know, he does that. All right, let's try that again. Who are you anyway? What's going on?
Evening, everyone. My name is James Wong. I am now the assistant coordinator for the Business Emergency Operations Center here at the NCEM. And so we support NCEM by developing and nurturing partnerships with our private sector partners. And so when I say private sector partners, we're referring to utility companies, so power, water, communications companies, pharmaceuticals, and pretty much the entire supply chain. So, you know, when you think of big companies like Costco, Walmart, even Amazon, and even smaller companies that you, or smaller companies that you wouldn't think of, like Uber. We do a lot of things with Uber and companies like that. But it's really building that bridge between the state of North Carolina and the private sector in times of emergency. So the BEOC doesn't actually fit into a traditional ESF function. However, many states have put together BEOCs, just like North Carolina has, especially in the last 6 years. And North Carolina actually is the only operational BEOC. So instead of just doing reports and plans and doing some of that initial legwork and then passing it off to logistics or to communications, we get down in the trenches just like everybody else. And we also will go on site with county EMs to help them with their private sector partnerships so that they can get the resources that they can't all get.
Wasn't North Carolina the first BEOC in the nation? Am I
North
right in
Carolina,
that?
first operational BEOC.
Okay.
Louisiana actually had the first BEOC.
Okay.
But so how does this work? Like, why would we want to partner with the private sector? So traditional procurement methods are very lengthy in state government or in any government. So if if the food bank needed additional reefer trucks, so the big refrigerated trucks, the state would look through their inventory and see, do we have any that we can push from another county to support the food bank or shelter or whatever that case may be. And if the answer is no, then trying to procure, even in an emergency, a reefer truck or pallets of water or whatever the resource is a very lengthy process. However, with our partnerships with the private sector, it's literally as simple as reaching out to our partners and saying, hey, Walmart, can you get us 6 truckloads of bottled water to a shelter in Cabarrus County or to New Hanover or wherever it is that's needed. And it happens all the time, in blue skies and in emergencies. And so we're really thankful to have the private sector supporting North Carolina Emergency Management and the citizens of North Carolina. And that's kind of where the BEOC fits. So if you look at how we work with the other ESFs, we are kind of we're the backup to them. So if logistics needs that additional support, if they need to find additional shelter locations or they need to find whatever it is that they need, or if it's communications, we'll reach out to our partners and try to fill those requests, either at a state level or even supporting our county EMs. And so, another good example, working with our partners, when the Red Cross needed additional warehouse space, we're able to reach out to our partners, trying to find them warehouse space for their supplies and inventory. And, Corning, stepped up and said, yes, we can provide 40,000 plus square feet of warehouse space. And so we're able to support the Red Cross with that. When the diaper bank last year in the middle of a pandemic got a 1 million diaper donation from a large manufacturer, they had nowhere to put it because no one's expecting 1 million diapers to just show up in your email and say, yeah, we're going to deliver it like in a couple of weeks. Where do we put 1 million diapers? And so they reached out to the BEOC and we're able to help them secure some warehouse space for that. So another good example, the mass vax operation that we had in Greensboro, communications needed additional help in getting communications equipment out there. And so we're able to reach out to our private sector partners, and Sprint And T-Mobile, pretty much rose their hands and said, yeah, we can send out some heavy equipment out there. And they did. And subsequently, suddenly, someone realized, what, we need to operate 200 iPads and another additional 100 laptops and then everyone's cell phones. How are we going to power all this equipment? And so then there was a resource request asking for, power trailers that we could put out there to power all of these devices that we needed to keep the mass vaccination site running. And we were able to get that also from Sprint T-Mobile. So, those are great examples of how the private sector has answered the call when North Carolina has needed them the most. And it's something that a lot of people don't realize even exists. And so here at the BEOC, we develop and nurture those relationships. So it's just like, it's all about relationships, right? We might meet somewhere at a networking event or virtually on a conference, and we might exchange contact info. But if I never hear from you and months and years go by, when the time comes that your email shows up in my inbox and it's saying, hey, James, we really need your help to do X, Y, and Z, I'm thinking, who is this person? I'm like trying to figure out who this person is. So, being a part of the BEOC is all about nurturing those relationships. So it's reaching out to those partners, making sure that if there's anything that we as a state can do to support them, we will do what we can. But it's really just keeping those relationships alive. So that when the time does come, and North Carolina has no shortage of emergencies, when that time does come, we can reach out to those partners and they'll be there ready to answer the call. So private sector partnerships are a huge part of what the Business Emergency Operations Center does, but we also handle vendor reentry. So in the state of North Carolina, per NC General Statute 166A, the vendor reentry program is mandated by that general statute. And so what it has created is whenever we have to evacuate certain parts of the state, whether it's by county or an entire region, the reentry program allows vetted companies the ability to re-enter those evacuated areas. And they're broken up by like life versus health and then economic well-being. So obviously your power and utility companies, they're going to fall under life. So all of those companies we vet every 3 years and certify them and their staff to be able to get through those security checkpoints, to get into those evacuated zones so that they can stage up life-sustaining services. And so the second tier would be health. So health can be your pharmacies, and even to a certain extent your grocery stores and stuff like that, depending on the emergency. And so we would certify those businesses to go in at when we open it up to health. And then of course economic well-being is that third level. And so economic well-being, those would be like your banks, because if you can imagine going back to your home after it's been evacuated, especially from a hurricane, if there's damage, having the ability to get to a financial institution, having the ability to get to a supermarket or your local pharmacy to get the things that you need so that you can start putting everything back together. That's pretty critical. And so the vendor reentry program is a huge one. Every 3 years, every company has to get recertified. And so that window opens actually May 1st. So we've been very, very busy the last couple of weeks recertifying all of the businesses whose certifications expired this year. But that is, that's another piece that we work with. And of course, like I said, supporting our county level EMs. So that's a huge piece of what we do as well. And so we get a lot of resource requests direct, from the counties asking for things that they can't readily get within their own structures at the county level or even at the state level. And so if it's something that, is not readily available, again, we'll reach out to our private partners and see if we can accommodate those requests. And so that kind of gives you a quick Cliff Notes version of the BEOC and what we do. And so how can CERT volunteers get involved? So we actually did a couple of workshops, and we got, I think, just under 100 CERT volunteers trained up over those two trainings to support our non-congregate sheltering program. So obviously with COVID or any kind of pandemic, the ability to shelter people in congregate shelters is kind of off the table. So congregate shelters being your schools and auditoriums and arenas and stuff like that, it's not recommended during a pandemic. And so we had to quickly figure out what can we do in the event of emergency where we have to shelter people. And so we developed a non-congregate sheltering program that utilizes our hotel partners across the state. And so we're able to quickly develop an online portal that ties directly into our WebEOC platform that allows our hotel partners to log in, update their hotel inventories, and provide us with 72-hour courtesy room holds in the event of a state of emergency. And that gives us that information and the ability to evacuate people from counties or entire regions, get them processed through reception centers, and then at the reception center, lodging coordinators would be able to assign an individual or families to a designated hotel or hotels so that they are safely housed during the emergency. And so, you know, we had quite a few CERT members interested in that program, and you know, we were able to get them trained up and they're ready to go. And so even though COVID is hopefully coming to an end, the program is still it's still a very viable program. You know, one of the biggest challenges that the state has is just having enough even congregate shelters. And so in a situation where we just run out of congregate shelters, we would have to, you know, what a viable option would be to revert back to non-congregate sheltering as a backup plan for that. Or whatever comes down the line, COVID 22 or 39, whatever it is, it's, you know, anything short of a Sharknado, we have this program in place. And I can tell you that for my director, Persia, and I, like, we are so thankful to have NC CERT volunteers as part of our program, because we know that, you know, when stuff hits the fan and we have to put people somewhere and lives are at stake, we know we can reach out to CERT volunteers to help support our program and quickly onboard new hotel partners on the fly.
So we put our newly trained CERT volunteers to the test for our statewide hurricane exercise, and I think that was great. And what was cool, because we had never done this before, is it was all virtual. So everybody did the training from home and they participated in the exercise from home. Can you tell everybody a little bit about what the CERT volunteers did during that exercise?
So during the exercise, we're monitoring the significant events board within WebEOC. So that's where all the counties and all the ESFs are updating, you know, whatever situation is going on in their realm or in their county. And so whenever there were requests to put evacuees, so New Hanover County needs to evacuate, you know, 1,500 people, and we want to put them in, let's say, Johnston County, we would then look within our system, figure out how many hotels we have within Johnston County and surrounding counties outside of the affected areas. And if we realize that there are gaps, which during the state exercise, everything's a gap on purpose, we're able to assign groups of CERT members to find additional hotel partners. And this was a live exercise. They were assigned, okay, you 5 CERT volunteers will look in Guilford County and find us as many hotels that aren't already in our system as possible. Contact them, try to get an owner or a general manager on the line, explain the program to them, and onboard them into our program. And so they were making real phone calls, talking with real hotels, saying, hi, I'm with the North Carolina Emergency Management. You know, we are onboarding hotels today, you know, as part of our statewide exercise, but in the event of emergency, we would love to use your facility for emergency sheltering. Is that something you'd be interested in? And if the hotel said that they were interested, then they would, put their contact information into a database, and then we followed up with them that day to onboard them into the program.
And how many new hotels did you get during that day of the statewide exercise?
I had a feeling you were going to ask me, but I forgot to write down. Wasn't it like 98?
It was in the 90s. Yeah, I
Yeah.
know it wasn't 100, but so that's
It's just short of 100.
nearly let's just round it and say 100 new hotels that were added to our database, and that was CERT volunteers making those phone calls. And it makes me so proud that y'all, those who participated, had a hand in doing that, and I think it's really huge. And the other thing I think that's important to mention as they were calling the hotels is we're not asking the hotels to do this for free, right? So we're going to pay for these rooms at the state rate, which for some hotels is less than what they might get. But what if you own a hotel in or near an evacuation zone? Probably you're going to have a hard time filling your rooms, so it would be better to rent them at a lower rate than just to have empty rooms, right? So I think it's a win-win for everybody. And I mean, it's good PR for the hotels too, right? So it can be a win for them on that front as well. So yeah, we're super excited to be partnering with James and Persia and learning more about the non-congregate sheltering. That's the NCS program. And it's a really exciting time to be a CERT volunteer in North Carolina. You have so many opportunities. So what questions do y'all have for James?
So I will say beyond just the non-congregate sheltering, and even that, like, so everything that we did for the state exercise was all virtual. I know Samantha's been working with Human Services on opening up additional roles for CERT volunteers so that you could actually be, if you wanted to be, at like the reception centers as a lodging coordinator, or being on site at the hotels as a hotel liaison.
Yep.
And how all those tie together. I mean, we have our software platform that manages all the data, but as the evacuees are leaving their home counties and going to the reception centers, there needs to be a lodging coordinator at the reception center that would be checking them into their assigned hotel. And so again, you're using the same system, but this would be a boots on the ground position. And so you'd be adding that individual or family into the system and then directing them to the hotel that they've been assigned. They will either self-transport or the county will bus them to those hotels. And when they arrive, there's another boots on the ground position, which is the hotel liaison. That person or persons would go into the system, verify that the evacuees standing in front of you are in the system and that they're at the right hotel.
Crucial.
And once that's verified, then they would authorize that evacuee to check in to the hotel, and that's how we would track all these evacuees within the system. And so there's definitely virtual things that you can do, and for people who are just tired of virtual and are feeling
and you want to get out there,
there are definitely boots on the ground positions too. And separate from non-congregate shelter, like I said, it's the BEOC doesn't fit into an ESF because we kind of do a little bit of everything. We're kind of that unicorn group that I always joke with people. It's like what other teams don't want to do, they just kind of throw on a BEOC. So it's like, well, we can't find X, Y, and Z. Let's see if Persia and James can find it. And
it's appropriate because you and Persia are both very unique personalities, and so it's like the perfect place for y'all to be. So that's great.
Yep.
And so what James was talking about with Human Services, I am still talking with them. So you will see emails from me coming out soon with some online training that y'all will be able to do so that you'll be able to actually work in shelters and that sort of thing. And we're still working that out. That's why I haven't sent it out yet, but it's coming very soon to an email inbox near you.
So regarding, like, separate from our non-congregate sheltering, when the BEOC is working with our private sector partners to fulfill a particular need, whether it's services or products, there's definitely opportunities there. So for those of you who are interested in communications, when we're reaching out to our partners like Verizon or AT&T or whatnot to set up these mobile hotspots or just communications equipment, typically there's opportunity there to involve CERT so that you're out there with the Verizon teams or with the AT&T teams to set up some of this equipment get hands-on experience with it and pretty much augment NCEM on behalf of BEOC as you're working with our private sector partners. If communications isn't something you're interested in, there's lots of things. You know, at one point last year, we had an overabundance of PPE, not early in the year, but at the last part of last
Eventually.
year, as everything started showing up very late, we had an overabundance of PPE, and so we're coordinating PPE distribution sites, and so that would have been a great opportunity. We weren't unfortunately working with CERT at that point, but if we were, that would have been a great opportunity for
Yeah.
CERT members to, again, be boots on the ground, help distribute this vital PPE to the communities that needed it the most.
Yep.
And so if
James,
can
are you willing
imagine-
to share your contact info, whether it's you personally or a BEOC email, something in the chat there, so folks,
Yeah, I can do that.
want to learn more, they can get in touch with you. That'd be great. Yeah.
But I mean, that's that's kind of what I have as far as the BEOC. It's we are an interesting animal, but we love what we do because every day is different. And I imagine a lot of volunteers that sign up for CERT are the same way. It's, you signed up because you want to help people, especially your neighbors across the great state of North Carolina, but you don't necessarily want to be pigeonholed in a particular bucket of job responsibilities or knowledge. And I mean, the private sector definitely keeps us on our toes, and we learn all sorts of cool things working with these private sector partners. So there's definitely opportunity there.
That's great. I hear him typing.
Samantha, if I may.
Yes, ma'am, Miss Ann. How are you?
Wonderfully blessed. I'd like
Awesome.
to mention that as a retired emergency manager, I can certainly say that the BEOC has been a wonderful asset to emergency management, and I certainly appreciate all of the efforts. And while I'm speaking, I'd also like to mention about some of the things that my CERT team has been doing.
Please.
Today, as a matter of fact, we're out actually installing road signs. We actually make them in our office, and the CERT team members would actually go out and erect them on the roadway.
Wow.
So mention that.
That's a new activity for CERT I haven't heard before.
Yes,
I'm sure you've taken pictures of them out there putting the signs up.
We've certainly done that, so we can get them up to you.
Good. I want to put them on the Facebook page so everybody can see what y'all are up to out there in Washington County.
We'll do just that.
So good to see you.
Thank you, you too.
Anybody else have any questions or comments for James? Yeah, I see Margaret's on. You remember Margaret, James, and she said she enjoyed the opportunity to help virtually from her home. And that was really great with this. It's the first time we've been able to do something like that. And, maybe this is part of the good that's come out of the whole pandemic, is that we are learning new and different ways to do things. And we don't always have to all be in the same room. It's nice if we can be, but we can still get a lot done even if we're sitting in our own homes. That's great. All right. Any last words for James? James, thank you so much for taking your time out of your evening to join us tonight. I really, really appreciate it. And you might see some of these names and faces coming across at the BEOC in the coming months.
That sounds good to me. Thank you
Excellent.
everyone for your time and for the CERT members who are already working with the BEOC. Like, you are amazing. Persia and I talk about the CERT program a lot now. I kind of wish we knew that it was a resource that we could pull from many ago. So
I've been trying to sell it for years, and people are finally starting to listen. So that's great. Yep. I've had a request to put the Facebook link in the chat. So that's the CERT Facebook page. I just pasted that in the chat. So please check that out whenever I have new classes coming up. I put it on there, and I always like to brag on what people are doing. So when Miss Ann sends me those pictures of them out there putting up the road signs, you can bet that will be on the Facebook page so that everybody knows what's going on. And I love to do that, to share what all of you all are doing, because across the state, CERT volunteers are doing just amazing things. And I think it's very inspirational to other teams to see, what Washington County is doing and say, hey, well, we could do that here. So I love that kind of sharing. And I know not everybody does Facebook, and I apologize for that, but it's just the platform I have at the moment to be able to share those things. Thanks again, James. Really appreciate it. And I know that we are well into an hour and a half at this point. I did, though, want to see if anybody has any general CERT questions that I can attempt to answer, or if I can't answer them right away, I will find answers and get back to you. But what is on your minds as CERT volunteers? I see Nicholas's comment in the chat. I appreciate that. Well, certainly value our veterans tremendously, and they have so much great experience and a wealth of knowledge. And we have so many veterans as part of our CERT programs that I think it's a great overlap there with CERT and using our veterans. That's fantastic. Where's the best place to find new CERT basic classes? So all classes in North Carolina will be listed on terms. You all should be familiar with terms. This is where we put all of our classes. I'm putting the link for that here. And actually, let me, I'm going to share my screen for 1 second because not everybody maybe is totally familiar with terms. Let me just show you what it looks like. So when you first log on to the terms website, this is what it looks like. And there are several ways that you can search for classes. So I have logged in as myself. When it's your first time here, it'll say first time visitor, you create an account. It's free, but it just asks you to put in some information for an account. The way that I like to search for classes that I think is the easiest is to click on calendar. And let's say I want to know in every month, I'm going to make that blank. It automatically defaults to the current month, but I'm going to make it blank. And I'm going to say I want to search by CERT and then do find offerings. So you can see all the classes coming up here. One thing I will caution you on, sometimes you'll see something like certified floodplain analyst because it has the letter CERT in there, so it'll pop up in your search. But all of our upcoming CERT classes will be listed here. So that was a great question in the chat. Thank you for that. This is terms again, so you can search by the calendar, search on the word CERT. And if you're not familiar with terms, I'm going to take that out of the listing for a second. Let's just look at the month of June and see there are so many classes that are available in here, and the majority of them are free. And for some of them, but not all, if the class is more than 50 miles from where you live and you would have to spend the night, we would reimburse your hotel and your meals. We don't do mileage, but we do hotels and meals. So for example, here, Nicholas was talking about SMAT earlier. So there's a monthly meeting of the Triad Healthcare Preparedness Region. So you can find those sorts of meetings here on terms. A lot of CERT volunteers get interested in critical incident stress management. There are classes on that all the time offered. So all around the state. This one happens to be in Durham. I have no idea what WinLink radio email training, and that's an Auxcomm. So that's for our communications guys. I see that class is full. We have drone training. If you want to get your drone license and you want to take the class to help you prepare for that. ICS 300, maybe you've done 100 and 200 online and you want to go a little more in depth into the incident command system. Anyway, please browse terms. I mean, look at this is just June. Look how many classes are on here. And they're all over the state. So there's something near you, and or if you have to travel more than 50 miles, you may qualify for a travel reimbursement. So be sure and check that out. There's lots of good opportunities there beyond CERT. There's lots of stuff. What other questions do you guys have? I think I missed something in chat. What have we got? Oh, somebody's already doing WinLink. That's great. All right, so you've got a few people who have done the practical part, need the practical part of CERT. So they've done the online class, and so you're looking for a hands-on. Rusty, are you a trainer? You've done Train the Trainer, haven't you?
Yes, ma'am.
So you can do the hands-on yourself, and I can send you the checklist that you need. So for those of you who don't know, during the pandemic, when a lot of us were not able to do in-person training, there is an online class that comes out of the University of Utah. You can find it at onlinecert.org. So if you have folks who need CERT training or want CERT training, they can go there and take the online class. It's still about 20 hours, just like doing the in-person class. But the thing is that there are some hands-on skills that you can't learn from an online class. So if you, to do the online class, you still need to do a practical, and that's what Rusty's asking about here. And so there's a checklist of what they would have to go through. It takes about 6 hours, maybe. I usually do it like on a Saturday. And then once they go through all of those, then they've had all their CERT training, and we can check them off as being, volunteers. So, but you do need to be a trainer. You have to have trained the trainer to be able to administer that. Let's see, I missed a couple other questions. The best play, though, I did that one. A link for active CERT teams. Yes. We do have a page off of Ready NC, which is emergency management's page, readync.org. I'm going to put this link here. You click on Get Involved and then CERT. And down at the bottom, I do have a link. This is current as of, does it have a date on it? I think this was March, and I have had a couple more added. I'm going to put this link here. So this is the main link for the CERT page off of Ready NC that I just pasted in the chat. And if you scroll down to the bottom of that page, there's a PDF there, and it's just called nccertprograms.pdf. And that is the list of all the current teams. And again, I do need to update it because I think I've had 1 or 2 new teams since I posted that in March. What else? Are there opportunities in the area for CERT members to get CPR training? Sharice, I believe you're in Morrisville. So there are actually, the best place for folks who are in Wake County to do CPR training is Wake Tech Community College. And since you all are affiliated with the Morrisville Fire Department, you're able to take that class for free because they offer free classes for those who are in public safety. So check that out. It would be through, go to Wake Tech and look for public safety. And if you can't find it, let me know and I'll be happy to look that up for you. But yes, Wake Tech is going to be your best bet for that. And it's free. A lot of CPR classes can be very expensive. So free is a really great price for a CPR class. So check that out. And if you're in another county, check out your county's community college, because they most likely offer free training for public safety personnel as well. Let's see, any other questions? Don't see anything. Oh, something else just popped up. Yep. So yeah, as Rusty says, CERT falls under the NC Volunteer Rescue, so some classes are free. That's true. And many of our CERT programs are affiliated with fire departments too, and so that helps get them in under that public safety thing. If you have any issues with trying to take a class at a community college, let me know, because some folks aren't familiar with the CERT program, and I'll be happy to call up that college and talk with them and fill them in. All right, any last questions? All right, I'm going to put my email, which I hope you all do have, but this is the short one. If you don't want to try to spell my big long name, you can just send an email to cert@ncdps.gov, and I'm happy to talk with you guys about anything CERT related anytime. We have some different supplemental classes if you're looking for additional training for your CERT volunteers, like if you just want an introduction to wilderness search and rescue. My husband and I developed a class we call SAR for CERT, because again, we love our acronyms, but we're happy to come and put that on for you. That's just a one-day class, and it's intended for people who have never done any kind of search and rescue, other than, of course, we do light search and rescue in CERT, but you've never done wilderness before, and you just want a taste of what that's like. That's what that class is intended for. And again, he's a paramedic, so he has a class he calls the first 10 minutes, and that's a great class. It's about 2 or 3 hours, and it's kind of, how can you take care of a patient in the first 10 minutes after a trauma or an event? What would you need to do? So that's some great medical training. And, if there's other training that you're specifically looking for, if I don't do it myself, I know a lot of cool people who do this wonderful job I have, and I can probably find somebody who can do a class for you. So whatever it is that you're looking for, just let me know, and we'll try and make it happen. Great. Thank you, Margaret. I appreciate that. trope there. Well, guys, I really appreciate everybody coming out tonight. I'm sorry I kept you nearly 2 hours, but I hope you enjoyed our speakers tonight, and we'll do this again in a couple of months. But thank you so much for being here, and I hope to see y'all in person really soon. It's great seeing all these little squares on my screen, but I kind of want to hug you guys in person. So y'all take care, and please shoot me an email, give me a call, let me know what I can do to help you out, okay? Bye, guys. Stay safe.
Thank you. You too.
Thank you. Who was that, James? Little cutie behind you there.
Hey, Samantha.
Yes.
It's Mark Sellon.
Hey, Mark.
Are you familiar with the Community Mass Care and Emergency Assistance course through NCBRT? I think it's G0108.
I have heard of it. I've not done the class myself.
Okay. Very good if you get a chance to look into it. And again, it's another one of those things. I think that one's through LSU as opposed to TEEX, but you get a big enough group,
Yeah.
they'll come out and teach it. So
Yeah, that's great. Awesome. Thank you for that.
yep.
Yeah. Thanks, Mark. Appreciate your input tonight.
Oh, no problem. This was fabulous. Really,
Great. I'm glad you enjoyed it.
like I said, being new, it's great to see what all the other opportunities are that are out there. So
They're almost infinite.
and so is my training over 25 years. So I've trained in a lot of things
Wonderful.
and thankfully haven't had to use much of it, but
That's good. It's like having car insurance, right? We hope we
Exactly.
never have to use it.
right.
Yep. Right. Good to talk to you.
Yeah. Take care. Thanks again.
You too. Bye, Mark.
Bye.
Hey, Maggie. Good to see your name.